and pastries in a conference which is meant for obesity control. We are talking about ill effect of the screen on an online platform. Nevertheless, we will take this small bitter pill for a wider gain, that is, better eye health. So before I dive into the discussion, let's discuss the relevance of the topic. I'll give you some scenario. Here we have Arav, a school-going boy. He started his online classes during pandemic, and parents get him to my OPD with continuously increasing spectacle numbers. In second scenario, we have Abha, very smart teenager. She's a rock star on social media and complains of mood swings and disturbed sleep. We have Siddharth, who is a high-performing professional, glued to the screen for 10 hours, 12 hours, maybe more. He has won all possible awards in his company, but complains of constant backache, eye irritation, and dryness. Now I have a question for all of you. Do you all correlate with these scenarios? Do you have Arav, Abha, and Siddharth in your family? If your answer is yes, please give me a thumbs up. Yes, most of us will be having similar scenarios in our family. So, the problems what these people face is nothing but association of digital eye strain, also referred as computer vision syndrome. Studies say that 70% of people who work on computer for more than 2 hours a day are bound to get this syndrome. It is a set of disorders related to vision and eye due to prolonged screen hours. Electronic displays like laptop, desktop, tablets, smartphones, all can be responsible for this. Actually, all these devices are integral part of our daily routine. May it be office presentation, PPT making, projects, shopping, banking, online classes, socializing, gaming, surfing, and many more. We need them all. Even our youngest friends can't be kept away from the blue screen. Just to personalize, me and my son, we both got exposed to computer screen at the age of 15. Only thing was, it was 15 years of age for me and 15 months for him. We get super moms in our OPDs. They say, टीवी लगा दो, राइम्स लगा दो, बच्चा जल्दी से खाना खा लेता है. कार्टून बंद कर दो, रोने लगता है. So our super moms are coming with super tricks for their super smart children using smart devices. But as they say, everything has a price to pay. Long hours on computer can give rise to some eye problems. We may get chronic red eyes, burning sensation, grittiness, chronic rubbing, dryness, watery eyes. Sometimes blurring of vision, difficulty to focus, and frequently changing refractive errors. This can be associated with sleep disturbances and postural problems like backache, neck stiffness, and more. One of my students, she is doing her project in myopia. So I will like to elaborate a bit about it. Myopia is basically short-sightedness. We give minus number glasses to our patients for this condition. In addition to genetic power, some environmental factors like prolonged near work, lack of physical activity, and lack of sun exposure, causing vitamin D deficiency, all this tend to progress myopia very fast. We could see these results after pandemic was over. Because of lockdown, children couldn't go out, could not play, and their numbers are increasing like anything. So friends, how do we manage all this scenario? Can we actually get away without using these devices? Obviously not. But we can adapt to adopt, and for which I'm going to give you 3 S. That is Change your surrounding, screen, and self. Some changes we can make in our surrounding to reduce the ill effects related to electronic displays. How do we sit when we are working is very important. So we have a teenage reading a PDF document on her tablet, lying on the bed, not very advisable. Use a table and chair when we are working. The height of the table and chair should be in such a way that our feet don't lie hanging on the ground. We can use footrest if required. A good neck and back support is a must. Our forearm should be supported and the wrist should not be hanging on the keypad when we are typing. The distance between screen and our eyes, that is also very important. It should be around one arm distance, maybe 50 to 60 centimeter. And the center of the screen should be little below our eye level, say around 4 to 5 inches. Now I'll not tell you to take the protractor's set and measure it, but this little tilt makes us comfortable when we are working on a computer. Regarding overhead lamps and the light sources like windows, if they are behind or in front of the screen, they add up to the glare what we get from this screen. We should position ourselves in such a way that windows are to our sideways. This will reduce the glare and make us more comfortable. If required, we can use blinds. This makes working atmosphere little soothing. When we are working in air conditioner room, the air is little drier as compared to the outside air. Also, the airflow tends to make our eyes uncomfortable. So, avoid sitting directly in front of airflow and shift yourself little away from the AC. Coming to the second S, that is screen adjustments. Now, the fonts on the screens, they are not as sharp and well defined as our print media. So when we used to read our old books, we never felt so tired. We get those effects when we are reading anything on screen. So how do we manage that? Some changes in the setting of screen, like we can adjust our brightness to optimize it and match the ambient surrounding light. This will help us for the comfort. I suggest everyone to go to display setting and look for toner or auto brightness option. Just enable this, it will do the needful. The thumb rule is your device should not be a source of light in the room where you are sitting. Coming to the screen size, for me, bigger is better. In this way, our desktops are better than laptops. Laptops can be preferred over smartphones. So if we are taking this meeting on a smartphone or we have children at home who are taking their online classes on smartphone, I will say a strict no. Do invest in a good screen with good resolution. Same thing applies to our font size. Our comfort level, go 1 or 2 level above that. Reading very tiny fonts make our eye muscles feel tired. So the correct font size is very important. We do have filters which are inbuilt or they can be fixed on the front surface of the screen. This reduces the glare that comes from the screen. There are ARC coatings, anti-reflective coating, which can be incorporated on the glasses which we use while working on computers. Nowadays, everybody is talking about this blue light, which gets emitted from the digital displays. This blue light, it's a part of light spectrum, which suppresses melatonin, our sleep hormone, and thus disturbs our circadian rhythm, that is, our sleep cycle. So ideally, we should switch off our digital devices 2 to 3 hours before going to bed. When I suggest this to my patients, They give me the expression as if I'm asking them to donate their kidneys. I know it is difficult to follow this, but then how to tackle this problem? We have the options. Everyone is talking about this blue blocking glasses. These special glasses, they block the harmful blue light entering our eyes and give us the comfortable feeling when we are watching the screen. Some devices have inbuilt mode, like we can switch on the night mode, which will do the same purpose of blocking the blue light. As we can compare, warm colors are always soothing to our eyes as compared to the cool ones. Coming to the third S about self adjustments and working behavior. According to me, this is the most important S of all. Health never goes well without a good diet and a good sleep. Remember all our favorite bunny rabbit character with those beautiful eyes, always seen with a carrot in hand. Have you had your carrot today? Yes, the food products like carrots, green leafy vegetables, yellow fruits like papaya, mango, they are rich in vitamin A. And vitamin A is very essential for our eye health. Hydrating ourselves enough is very important. Around 3 to 4 liters of water a day is what we need to drink. Actually, it's not a bad idea to take a short water break. Let's sip a let's sip our water. While you are taking yours, let me take a water break and sip mine. See, it is not that difficult. Let's make a conscious attempt to drink enough. Drink water enough. Yeah, this is what I have observed. Many people, they don't wear correct glasses while working on computer. I have seen patients who come to me with those bifocals, with that C below. Now, what happens when they focus on the screen? They tend to see from that small area, small C area, which is meant to be reading anything at a distance of 33 centimeter. Our screen is little away as compared to our reading distance, right? What happens as an expense? They tend to extend their neck and then get this discomfort feeling. I suggest please go to your doctor, get your eyes tested, and take a good prescription of your glasses as per the distance between your eyes and your screen. Strictly no for those ready-made plastic china glasses. Buy a good pair of glasses and do use them when you are working. Coming to screen time, this question is asked to me by almost all the parents who visit with their babies. I'll say less than 2 years of age, definitely no screen exposure. Lesser the exposure, better it is. 1 hour is a good deal for 2 to 4 years old child. For others, screen time should be balanced with physical activities, hobbies, family, and social connect. Coming to the golden rule, that is 20 20 20. It says that when we are working on computer, we should be looking at an object which is 20 feet away for 20 seconds after every 20 minutes of our work. This reduces and relaxes the strain of our overburdened eye muscles. As they say, you tell me, I will forget it. You teach me, I'll remember. But you involve me, and I'm going to learn this forever. So why then? So let us try, all of us. We take a 20 seconds break because we are on screen and come back to it after this short break of 20 seconds. Can we all do that? Give me a thumbs up in between if you're following me.
Yeah.
Yeah.
Yes.
Yeah. So all of you off screen and look at some distant object for a few seconds till the time I call you back. Okay, we can continue. Going to my next slide. Yes, here I have shown. See, the front surface of the eye is coated with a film called tear film. This is basically little different from the tears what we get. Our tears are aqueous component which protect and give nutrition to the front surface of our eyes. But these tears, to stick and stay on our front surface of the eyes, we require mucin and lipid layer. When we blink, this layer spreads over the ocular surface and lubricates it. So blinking is very important. We blink around 15 to 20 times in a minute when we are not on screen, when we are walking, when we are talking, when we are eating our food. But as soon as we are on screen, we forget to blink. We keep on staring, looking at the screen, and the blink rate goes down to less than 6 to 7 blinks a minute. Not good. Let's blink. To start with, make a conscious attempt. Like whenever I press my enter key or whenever I am clicking my mouse, I'll blink. To start with, this will be a conscious attempt, but later on, this becomes our reflex. Yes. Hope it was useful to understand the physiology. Coming to our next slide. So people who have this eye strain problem, I advise them to wash their eyes frequently. Just close your eyes and splash clean water. Make a habit of doing this 3 to 4 times a day. Some people get the comfort by warm compress for few seconds. Sometimes we may have to prescribe lubricating eye drops for symptomatic relief. Daily rush in life needs a break. And same thing applies when we are working on a computer. Yes, take a break, at least 5 minutes after every hour of working. Just get up from that chair, walk, talk to your colleagues, look outside the window, breathe deep, relax. Life is not all about the rat races. Halt, introspect, analyze, execute. Friends, just decide what is our priority in this beautiful life. Isn't it? This is a leaflet I had prepared for printout or screenshot. Basically, it covers my talk for the day and reminds you to follow them so that we have better eye health.